Hi there. Let's give folks a moment to come into the room. Let's wait a couple of minutes. Thank you for joining. Ta-da-da-dum. Okay, I see folks coming into the room real quick. All right. Okay. Let's give them one more minute to join, and then we'll get this started. Oh, ta-da-da. Oh, Tampa Bay, amazing. Oh yes, folks, you can start maybe writing where you're joining us from on the chat, and then you know how to chat with us, and also I'll give you a bit of a visual of everything in a couple of minutes. Well, I think we can start right now. Well, thank you for joining us today, and welcome to our webinar, Unraveling the Secrets of Credentialing. Also, a warm welcome to our speakers, Dr. Jerry and Ms. Holly Lusby. So we truly appreciate you spending the next 45 minutes with us. So my name is Lena. I'm part of the sales organization, and as you have noticed, I'm going to be your host today. So before we jump in, a couple of items so that you can get the most of the experience on the webinar today. So as I said, there are 4 widgets in your screen. One of them is the comment box, which is located at the bottom of the right screen. And then if you can then please start sharing where you're joining us from. The second is the questions chat. So if you click on the question mark on the top right of the chat box, there you can send us questions, and then we will try to answer them during the webinar. If we don't get to answer them all, then we'll get to you via email. Some of you very diligently did send us some questions in advance, so we will go over those first as we start the QA session. Third, there will be polls. So some of them will pop under the chat window, and this will help us to know you better. And also it would be a good way to interact and to prevent you from falling asleep as we go through all the content. Fourth, but not less important, would be the handout. So at the end of the webinar, there's a tab called handouts, and we're going to put there the presentation. All the links are going to be clickable. So then you will have all the content that we covered here for you to review and use for credentialing, hopefully, to solve any doubts that you have and all that good stuff. What else? Oh, so at the end, we're going to send you, after the webinar is over, we're going to send you an email, and it's going to have a survey, and we're asking you for your feedback. We tailor this kind of webinars according to your feedback. So it is good if you let us know if you liked it or any other topics that you would like us to cover for future webinars, of course. All right, I see. Let me see. We have a crowd. Amazing. Okay, so let me then go over the agenda. So at first, I'm going to tell you about Tolanis and how we started our path through credentialing. And then we will have Holly, who is our Payor Credentialing team lead. She has over 7 years of experience in this field, and she will give you an overview of Payor processes and requests. And of course, she'll give you all the pointers that you need to be successful at the credentialing process. There's also Dr. Jerry, who is our partner and trusted billing advisor. Credentialing and billing go hand in hand. And Dr. Jerry has over 35 years of experience, and he has worked with TRICA, and his experience is crucial to this webinar, of course, as well. Okay, so I would like you to start with these 2 polls. It will tell us a little bit about yourself. Why are you joining the webinar, and what is your place in your organization? Oh, you guys are very quick to click in. I see credentialing specialists. I see business owners, practice managers. All righty. Oh, and it seems like you're all looking for general information about credentialing, which is amazing. Well, I'm hopefully you're going to get insights today. Thank you for completing the poll. All right. So again, I'm Lena, and for those of you who have joined, I'm the sales director here at Tolanes. And if you had a chance to go over our website, you may wonder why are these folks doing credentialing webinars? Because our website is very IT. So we have a business line which is credentialing, and I we started in this business because we were doing a consulting work with a very large healthcare organization, and credentialing was one of those items in which there was a Pandora's box. And they noticed that credentialing was key for them to be successful. And this is why I like to say that we are an IT company that credentials, because that's how our journey was into the credentialing business. Um, Other than credentialing, we also provide appointment confirmation services. We just acquired a call center, so we are providing those services now. And we also do website design, and we have everything I teach, which is the help desk and the consulting that you would require, as well as we have a very close relationship with Ring Central, everything that has to do with phone lines. So, well, you know a little bit about our journey into credentialing and why we decided and what our mission is in the credentialing process is. We noticed that it was so nuanced and complex, and we want to give that time to the providers to take care of the patients. It looks like you need a degree to be a credentialer, and then Holly will speak to that in a moment. But yes, we really want this to be as painless as possible for the providers, and that's why we are in this business. Well, now you know our motivations, why we do it, and well, Holly, over to you. Please enlighten us with all you know about credentialing.
Great. Thank you so much, Lena, for the introduction. I'm so happy you're all here today. Thanks for attending. And I'm excited to take you into the world of payer credentialing. All right. So first, let's start by defining what payer credentialing actually is within U.S. healthcare. So payer credentialing is the process by which healthcare providers, such as physicians, nurses, therapists, even groups or organizations, apply to become participating providers in insurance networks or payers. So payer is a term that we're going to use to define an insurance company or MCO. So that's everything from commercial to private, such as Aetna, Blue Cross Blue Shield, United, Cigna, Medicare, and Medicaid, all referred to as payers. The purpose for this credentialing, it's really to ensure that the provider or group can meet all the standards required to participate in a specific insurance network. These standards can vary by payer and by state. Payer credentialing involves the verification of a provider's qualifications, such as their licensures, certifications, education, malpractice insurance, and their unique provider IDs. This criteria for verification varies based on the type of provider you are. So for example, if you're an MD, such as a heart surgeon, you're going to have a different experience than a dentist. And someone in behavioral health is going to have different experiences if they're a psychiatrist versus a licensed professional counselor. These things are just important to keep in mind while going through the process. There are hundreds of different payers across the country. So some are specific to the certain state you're in. Some are even specific to the county that you're located in. One provider may choose to enroll in 5 payers. Another provider might choose 20 payers. It's really dependent on individual needs of the provider and the type of services you offer. Credentialing with a different variety of payers is important for gaining access to a wider client base, streamlining billing and reimbursement purposes, and really just creating relationships with these insurance companies. It ensures that patients can receive covered services from qualified healthcare providers, and it really ensures patients and clients that the provider they're seeing has been fully vetted. Right, poll time. So I'll welcome Lena back to the stage to take you through another poll.
Yes, thank you, Holly. So, well, what are the blockers you have experienced in the credentialing process with credentialing with payers. So we have these options: time and planning. Like you think it's going to take much shorter than expected, but then no. Compliance mistakes, unawareness of the documents that were required to the process, or all of the above. Oh, I see all of the above moving up quickly on the poll. So yes, that isn't surprising, because as I said before, there's a lot of attention, detail, and things that you need to have in your radar to be successful, to have a successful process. Well, yeah, again, all of the above is the winner. Okay, Holly, you can take it away again.
Right. Thanks, Lena. Right. So yes, each payer is going to have their own unique method to how they receive and process our applications. So knowing the correct forms, the required documents, all the information necessary is a really common problem that providers encounter when they try to initiate their own credentialing. Some payers operate out of secure portals that require logins. Others will have a request a fully filled out packet to turn in. Everything can be done digitally though. Payers have their own internal credentialing departments as well that process the information we submit to them. They can change this process at any time. That's why it's really important for us to have, someone like us following up with these payers to make sure that we are doing the correct process. The industry standard time is 90 to 120 business days from the time the application is submitted to the contract or welcome letter being received. Although we've seen in reality that this time can really vary. It can be shorter or a lot longer than that 90 to 120 business days. It varies depending on the payer and sometimes the state, the time of year, but that 90 to 120 days is the industry standard that they're going to tell you. And again, that's the time we submit the applications to the time you actually get the contract. Now that we know a little bit about payer credentialing, how does this process work? So from end to end, this is our Talanis credentialing process. I'm going to take you through a few steps. So first, we're going to start by establishing the needs for credentialing. So what type of provider are you? How many providers need credentialing? Is it a brand new practice? Is it an established practice and you're adding new providers to your group? What type of services do you offer? All of that we're going to discuss with you before we decide how to proceed. So we'll discuss the types of payers you want to be credentialed with as well. Next, we will do a kickoff call with our team and with you, the provider. During this call, we're going to discuss and explain our process and expected timeframes. We'll start submitting applications the first 2 weeks that we receive all of your credentialing documents and information. We're going to discuss cadence for our weekly updates that we'll give you on our process. That will be weekly every Friday. That's how we operate. We will discuss payer priority with you. So if you don't have an idea of payers that you want to work with, we can do research for you to find the best payers in your state, the best payers in your city or county, depending on the type of services you offer, of course. And we're also going to discuss the priority of the payers you want us to start with. So if you're really wanting to get in network with a specific payer, we can start with them first. Then we're going to give you a brief explanation of the payer's process, so you kind of know a little bit about how they will process your information. And then we're going to give you an introduction to our platform called Credentialing. So that brings us to the third step, is where we will receive and process all of your credentialing documents. So we're going to explain to you what Credentialing is, and it's our platform that securely and safely stores your documents. So once we get all the required documents, credentialing information, and logins from you there, we can start submitting the applications. So yes, that's where we're going to send you the invite to our platform and kind of just explain the different types of documents you're going to need. I know there's a lot of different type of documents depending on the payer and depending on the provider. So we're going to explain all of that to you. Right. Now we are going to verify your credentialing information. So what that means is we're going to go into platforms like CAQH to make sure that you are up to date, you're attested, all of your information matches what you've sent us. So making sure your practice information, like your address and your phone number, all of that is up to date. We're going to make sure that things like, for example, your W-9, your legal business name written on your W-9, it has to match your IRS letter legal business name. We see people run into that problem a lot, but we're going to make sure that everything is really just up to date. Nothing looks like it's close to expiring. All of your information matches in your CAQH. So then we're going to organize everything and get ready for submissions. So now we're going to start actually submitting things to the payers. The initial application can be the first step. Sometimes they just require one application. Sometimes payers are going to require 3 different applications. We're going to follow up with each payer every day to make sure that they have received our initial application and that they confirm that they are processing it. Right, then we're going to do payer follow-ups and provider updates. So after the payer has confirmed that they've received our application and they've received all the documents required, we just follow up with them to make sure there's any next steps they need for us to do, any additional documents, any additional information. We just want to make sure that they have everything they need to continue their process. So all of these payers are followed up with weekly, and we are checking just to make sure that everything's in process, nothing additional is needed. We're going to send an update to you every Friday to let you know all the payers we've contacted, what they've said for every provider we work with and every payer we work with. And we send that out every Friday. And then the final step is completion and ongoing monitoring. So during and after this credentialing process, we will be monitoring all of your credentials and your attestations. So we're going to make sure that your CAQH is updated. We're going to make sure that we watch for your licensures to make sure nothing looks expired. All of that can be monitored in our platform Credentialing. So that keeps track of all of your expirables. That'll keep track to let you know when your license is due for renewal, when your professional liability insurance is due for renewal. We will keep all of that for you. Yes, then once the provider is considered in network, participating, or active, you will receive either a welcome email or a physical contract to let you know that you are currently in network. And they will give you an effective date. That means from that day, you can start seeing patients. Sometimes the effective date is backdated. Sometimes it's a month away from when you actually get the contract. So you'll know from that effective date when you are able to start seeing your clients. And once this credentialing process is completed, we will continue to monitor your licensures, your expirables, and all of your attestations. All right, another poll. So Lena, welcome back to the stage.
Thank you, Holly. So we would like to know, there's a lot of content here. So we'll just want to put out a poll on have you learned something new so far? Let's see. Let's look at the clicks. Always so quick at clicking in, guys. Thank you for that. So it looks like still digesting is going to be the winner. And it is I sort of expected that could happen because it isn't a surprise because there's so much information and nuances that happen in the process. So if you think that you need these services, you can surely book a meeting with us and we can help you out to navigate this process with Holly and the team. And of course, with Dr. Jerry, who you'll meet shortly. But first, I think Holly has still a couple of slides that she needs to go about.
Hey, thank you, Lena, for the poll. Right, so now that we've explained a little bit about payer credentialing and a little bit about our process and how our procedure is going through this process, why should you choose Telanis to do this for you? So it's important to stay informed about changing specific requirements and changing processes from different payers to be able to navigate this process effectively. So since we're the experts, we can help you navigate this process with the specific requirements of each payer. We know providers do not have the time to deal with applications, follow-ups, making sure their documents are right. It takes a lot of time to focus on, and we know you have a lot of more important things to focus on. So once we send in and submit your applications, your documents, credentials, everything, it can go through a few different hands and a few different departments within each of these payers' internal systems. So before it's completed, there's a few different departments it goes through. That's why it's really important to have someone like us following up, and we're the team dedicated to making sure that it's going to the right hands within these different payers. So payer credentialing also requires periodic reattestations to maintain your participation. So our platform, as mentioned before, Credentially, keeps track of all of these attestations, keeps track of your documents and expirables. As I mentioned before, we will make sure that you are up to date, you've reattested, and that they don't need anything else from you. So our platform Credentially also, it keeps track of everything. It's there for you to also use. So anytime you want to jump in and check on anything, you can also see all of your information in Credentially. All right. So thank you all for your attention and for allowing me to share insights into the world of payer credentialing. We really do pride ourselves in making this complex process smoother and more efficient for our customers. Now going into further insights to this process, I'm honored to introduce our esteemed partner, Dr. Jerry. He brings with him a wealth of experience and knowledge that I believe will be invaluable to our discussion today. So, Dr. Jerry, the virtual stage is yours.
Well, thank you so much, Holly and Lena. Really appreciate it. Great job going over the credentialing process. Really vital to the success of any practice, and obviously the billing process. A little bit about myself. I'm the founder and CEO of the Revenue Cycle Doctor. I founded this company about 2 years ago. After I decided to retire from all of my other businesses and ventures. I am a retired Navy medical officer. I spent the first 20 years of those 35 years that Lena so nicely told everybody that I give away my age, but it's actually closer to 40, Lena, but thank you very much. After I finished my Navy career, I served as a CEO, a COO in hospital, so my billing and credentialing experience is fairly vast. And I've also served as the chief of staff of TRICARE out on the West region. So my understanding of insurance and their nuances and the importance of credentialing is probably understated. But what I do understand is how, if you don't get it right, it can cripple a practice. So a few things about credentialing and billing and why the partnership is so important. Obviously, credentialing provides, obviously, and I think this is obvious, but it may not be to some people, but it does provide better access to care for patients. And what I mean by that, practices, if they decide to take on insurance companies, if they decide to take on additional payers, they're opening up their practice to additional patients. This provides patients an opportunity maybe to get care closer to their home. And I've got some experience with this, using TRICARE myself, and sometimes VA care. It's not always available close to your home, but sometimes if payers and practices work closely together and the practices do increase their credentialing for these payers, then patients can get care closer to home. The network versus out of network nightmares. A lot of times practices don't understand what they can get into if they don't hire a credentialing expert to help them with their credentialing, because they seem to think they can send in claims to payers that they aren't credentialed with, and they'll magically get paid. I've run into this with several practices and had to unravel their problems by going back and basically calling the insurance companies and trying to figure out why they weren't paying their claims. And it just came down to not being credentialed with certain payers. So and a lot of times the patients don't understand that too. So the practices come in to see, or the patients come in to see a certain practice that they want to see close to their home, and that practice may not be credentialed with the payer, and unfortunately, it's too late after the practice has seen the patient and the claim's gone in, and all at once the patient gets a bill for that occurrence, that claim, and they don't understand why they have to pay the entire amount. So don't put them in that situation. Be vigilant with your credentialing process. And then the one-stop shop for revenue cycle team. I think that goes without saying. If you have a billing and a credentialing partner, folks working hand in hand, it really can help a practice to predict their revenue a lot better, understand how much revenue they're going to come in, and there's no guessing, when it comes to what they're going to get paid and how they're going to get paid. They know exactly everything that's going to be coming in. So having a billing and a credentialing partner that you can trust is critical. So I guess the big question is, I had a lot of choices when it came to picking a credentialing partner, and I've been with Telenas about a year now, and why did I pick them? So I think the first one kind of blends into several of these bullets on here, but their customer service, I think, is second to none. And I've been associated with a lot of vendors and a lot of folks that working with hospitals and working with practices that you can't get them on the phone, or you can't get them to answer emails, and you're not going to find that with Telenas. They will get back with you with knowledgeable answers on your questions almost immediately. And when I had my first couple of interviews with them and talks with them, it was evident right up front. And I notice things. If they don't answer my emails right up front, I usually move on to the next person. And they were very vigilant and really knowledgeable about everything I asked them. And the second bullet, quick turnarounds on emails and phone calls, and not just from me, but I was CC'd when they were talking to some of my practices, and they are the same with each and every practice. They're again second to none when it comes to getting back to people and providing updates and all the things that Holly was talking about. And one of the things that I was, I guess, pleasantly surprised about is their knowledge on the regional health plans, and that's not always very easy. As most of you know that have been in this business for a while, that Medicaid, Medicare are different in each region, and so are a lot of the other payers. They vary from region to region, so it takes someone with knowledge of that region to go in and research and understand which payer to get you credentialed with, and they were right on target with every one. Price and value, they were the best out of, and I can't remember exactly how many I went out with, but it was at least 10 credentialing folks that I went out and interviewed and talked with. And their prices and value were well below. The price was well, the value was way above everyone else out there that I checked. And when I offer something to my clients in the way of credentialing, I want to make sure that they're getting the best price, and this makes a difference in how they can provide the care that they need to their patients. And, if they're spending too much on credentialing, that means they may not be able to hire that extra provider, or they may not be able to get that extra piece of equipment to provide care to their patients. So being smart about how much you're spending on your credentialing packages and understanding that you're getting the right value for the right price is extremely important. You're going to get that with Twin. And the team, we talked about it already, but the team is amazing, and really that goes all the way up to the CEO. And I had an opportunity to meet with him, Stephen Smith. He is retired military as well, and he has the same morals and ethics that I do, dedication to duty, commitment, honor, and all these things that I see as important in running a business, and especially in fostering relationships. And this goes all the way down throughout the organization. He leads from the front. So that's all I have, and I'm happy to take any additional questions as we go to the question part of the presentation. But I'll toss it back over to Lena.
Thank you, Dr. Jerry. So yes, we have reached one of the portions of the webinar that you may have been looking for, and let's go with the first question. So how long will I be part active with a payer, and when do I need to re-credential? Holly, maybe this one is for you?
Yeah, great question. So most payer contracts are going to last for 3 years, and you'll be informed of that when you get the either welcome letter or the contract agreement. They'll give you an effective date, and then it's usually 3 years from that date is when you're up for re-credentialing. And most payers are really just going to want your attestations and all of your demographics to be updated. So they just want to make sure, you're at the same address, you have the same contact information. They're going to want to make sure your CAQH is up to date, all of that. Some payers do require us to update them. If you've changed any information, you'll just have to resubmit an application form. So we'll do that for you. We'll just update your information and send that in. But yeah, it's really just every 3 years, and we can do all of that for you.
Okay, here is, I think that answers the question really well, Holly. Thank you. So what else do we have here? Can you negotiate rates for me?
Rate negotiation.
Maybe, yeah, like, can you negotiate rates for me? Maybe that's a combination between you and Dr. Jerry to go about this one.
Yeah, I can begin by answering that. We get that a lot. So rate negotiation is tricky because most payers do not want to do that with us. They want to speak directly to the rendering provider. They're going to give you a fee schedule, like a general range of what the pay rate and reimbursement will be. And it's really dependent on your licensure, sometimes just the state you're in, the services that you offer. And I'm sure Dr. Jerry can go into more depth on this, but the CPT codes that you're billing for, those are going to have different rates associated with them. So we usually can't do the negotiation for you, but we can definitely request the information so that you know what you'll be reimbursed. But yeah, does Dr. Jerry, do you want to answer more?
Sure, thanks, Holly. Yeah, and those are some great points. So whenever you're negotiating rates with insurance companies, it is a slippery slope, and normally they're going to want to see some data of reasons why you should get more than what their normal negotiated rates are. So whenever a practice asks me about the rates and why they're not so high and can they try to negotiate higher rates, I tell them the insurance company is going to want to see quality information. What's your quality metrics for the year? Have you had any incidents? How is your everything to do with your practice? Because they're going to want to see all that when you try to negotiate higher rates. And there's some worksheets and things that you can send in to do that. It is a fairly intensive process to be able to send that in. It is doable. I'm able to do that. Again, it's a fairly lengthy and potentially fairly expensive process to renegotiate rates with insurance companies, but it is doable, and there are folks out there that do it. I can do it. I don't normally do it, but there are folks out there that are very good at it, and they're able to renegotiate your rates.
Sounds good, Dr. Jerry. I think here's another question that really ties up with what we are discussing now, and is there a way to know how the payer rate, that I'm going to get? I think that's what it's a bit oddly written, but I think like the person wants to know if there's a way that they can know beforehand how much they're going to get from a payer before even applying.
Oh, is that for me? Yeah. So I would say the best way to try to figure out what the rate's going to be is to look at what CMS offers, what the Medicare rates are. And my rule of thumb is that if it's a commercial insurance payer, I multiply that Medicare rate times 2. And that's normal. That's about what your commercial payers are going to pay. And the CMS rates are widely available in each region. You pull that off the CMS website.
So that is something that the providers and the practice owners can just go into the page of the CMS or the Medicaid page, and then if they know their CPT codes, and they can go and look more or less and have a calculation of. Is that dependent on the state?
It's depending on the region.
The region. All right, Okay, I think that answers the question. Thank you, Dr. Jerry. So here we have another one. Do you do onboarding credentialing? Okay, so that would be a question for me. So onboarding credentialing, for those who don't know, is the process of getting a candidate or a provider from offer letter to day one at the hospital. And yes, we do have that service. You can book a meeting in the link. There's going to be a link in the presentation, and we can discuss more about that if that is a need that you currently have. And Manoj will also be following up with everyone in the webinar to connect and see if there's anything that we can help you with. Let me see. Well, there's quite a number of questions. Let me see. So this one is maybe in the same lines of what we were discussing, the rates. How do I know the best payers to enroll in my area? That's a question that we get a lot. So
yeah, I can answer that a little bit. Yeah, so it really depends on your location, because some payers are specific to usually it's by state. Sometimes it's even specific down to the county that you're in. So it also depends on, the type of services you offer. So I would say, a lot of just the top insurances, the payers like Blue Cross Blue Shield, Aetna, Cigna, United, all of those are going to be great commercial insurances. But if you're doing something like, let's say, pediatrics, you probably don't want to enroll in TriWest or TRICARE. That's mainly veteran based. But yeah, we can do that research for you and find out the best payers that are in your area, because sometimes there's going to be payers that are located, in, let's say, Arkansas, that are great for those types of providers. And then there's going to be different kind of payers in Texas. So it just depends on the type of services you offer and where you're located.
Yeah, and I can add on to that just a little bit, Holly. So normally, if I get this question, I'll even cheat. I like to cheat on some of these things. So I'll go to maybe a similar practice and go onto their website and look what insurance companies they offer, and I'll do that for 2 or 3 maybe, and kind of get an idea of what they're offering. And also I'll go to and look at what are the major employers in the area, and those employers normally offer a certain insurance for their employees. So if you find the major employers in the area, and employers that are employing like 10, 20,000 people, those will be good folks to try to grab as your payers. And lastly, if you're in an area like us, highly military intent, make sure you get TRICARE, and make sure you're looking at who the VA uses as their contractor. In our area, I think it's Optum that they use for their contractor. Take care of your veterans, take care of your military.
Well, I think that that's a great answer. Like, it's always good to also network beyond whatever Google can tell you, right? Like, who are the employers in your area? Take care of the VA associations. It's all about networking for every business. Okay, so I think we have time for one last question. It says, will you keep track of all my documents, licensures, things that expire? Well, I can just say really briefly, like, we do have that services. We believe in long time relationships. So we do the credentialing and we keep you monitored, and we have a process to do that for you. Holly, maybe you want to elaborate on how we do that, or which are the portals that we help keep them monitored.
Yeah, sure. Yeah, so we keep track of your CAQH, which a lot of payers use that to access your information. So if a payer goes in and sees anything that's expired in CAQH, or sees that you haven't attested, that can hold up billing and claims. It can also hold up your credentialing process in general. So that would probably be the number one to keep track of. But once you're already enrolled, there are platforms that a lot of payers use also to access your demographics, your licensures, all of that. And that would be stuff like Availity. There's a few payers that use Availity to make sure that you're attested every 90 days. And then there's also One Healthcare ID and Optum. That's usually every 90 to 120 days. So we do keep track of that. So once you're already in network with those payers, you do have to keep reattesting every 90 to 120 days with those platforms. So yes, that is something that we monitor. We'll just make sure, your license isn't expiring, or your professional liability insurance isn't up for renewal. Stuff like that we will keep track of for you.
And it is also very important, right, Dr. Jerry, because if those things are not up to date or monitored, then they can run into billing hiccups. Am I right?
Yes, that's one of the things I have a problem with normally when I take on a new practice. They normally don't realize how important that was, and that's one of the underlying problems with not getting their claims paid, because their credentialing is lacking, or they didn't do it correctly, or they just don't know how to do it. They're trying to do it themselves. Unfortunately, that's one of the first questions I ask: who's doing your credentialing? Nobody. No. I got a number you need to call.
Right, because, and I think we have gone through this, like Dr. Jerry, we had a prospect that they had about 200K out there, and then they were just not credentialed. And they expected to bill, but they didn't have any credentialing in place. So, or maybe somebody told them that they had. So it is very important that you do your research, decide how to get credentialed properly, because you're going to avoid yourself a lot of cash flow situations and a lot of headaches. And also, Doctor, I think there's something else that you also recommend your clients, that they get confirmation with the patients when they show up at the practice, and to confirm that their insurance is valid, right? I don't know what's the name of that process.
Every time, 3 days before, a week before, validate the insurance, do an insurance verification, do an online verification, call the insurance company, make sure they're in network. It saves so many claims getting denied, kicked back. It's hard sometimes to get the practice to do it because it's extra work, but you got to make them realize that they're saving themselves money, because their claims are not getting denied. They're getting paid on time when they do that.
Yes, money and headaches. Well, folks, we have 1 minute to go. Thank you so much for joining us today. We really hope it has been helpful. There are still lots of questions out there. We may plan a session too, so who knows, you might receive an invite for that shortly. Please visit our website, follow us on social media, and again, now the document that Holly was discussing and everything on the slides and all the clickable links are going to be in the handout portion of Demio. So please go ahead and download that. You'll also see the meeting link if you want to connect with us, and Manoj will connect with you and help you out in whatever you need. Okay, so we stand by to service you, and have a great rest of your day. Happy Tuesday, everyone. Thank you so much.
Thank you all so much.